Welcome back to Medicine Mindset. Today, let's discuss the typhoid fever. As an introduction, the typhoid fever is an illness that's caused by a specific bacteria called Salmonella typhi. This disease is characterized by high fever, abdominal pain, and gastrointestinal issues. It also primarily spreads through contaminated food and water, leading to severe health complications if it's left untreated. For historical context, the first documented cases of typhoid fever date back to the ancient civilizations, with significant outbreaks recorded throughout history. The disease required a pivotal role in public health movements, prompting advancements in sanitation and water treatments methods in the 19th century. In the year 2000, there was an estimated 21.7 million cases and 217,000 deaths globally. By 2015, deaths had declined to approximately 149,000 due to improved treatment and prevention measures. In terms of global prevalence, today typhoid fever remains prevalent in developing countries, particularly South Asia, Africa, and Latin America. Despite efforts to reduce its incidence through vaccinations and improved sanitation, approximately 11 to 21 million cases are reported annually worldwide. Typhoid fever results in about 110,000 deaths annually worldwide. In terms of regional distribution, it's particularly prevalent in endemic regions, such as South Asia, Sub-Saharan Africa, Southeast Asia, as well, with children and adolescents being the most affected. Data has also shown that females were more likely to take this disease than other adults. High burden countries such as Bangladesh, India, Indonesia, Nepal, Pakistan, and Vietnam contribute to around 80% of global cases. Later on in this presentation, we'll discover what causes these specific countries to be at higher risk of this disease. Additionally, specific outbreaks have been reported in regions such as the Democratic Republic of Congo and Pakistan. For country-specific incidents, we have the United States with around 400 cases annually and the most linked with international travel. These cases are acquired domestically and are rare and often traced to carriers or imported food. Brazil has a country Belém where typhoid cases increased by 300% in 2024 compared to the previous years. In the Philippines, a significant rise in cases was observed in the recent years, with over 7,600 cases from January to August in 1 year. Let's move on to the causes of typhoid fever. The disease specifically comes from a pathogen called Salmonella typhi, a rod-shaped gram-negative bacterium responsible for typhoid fever. This bacteria thrives in warm, humid climates and can survive in water for extended periods, making it a persistent public health threat. As you have noticed, some of these countries are also warm, humid, and have a large amount of population, which makes it a persistent public health threat as well. Improper disposal of sewage contaminates water sources, spreading Salmonella typhi and affecting aquatic ecosystems. Contamination of rivers and lakes and untreated sewage can lead to widespread typhoid outbreaks. Environmental studies show the presence of Salmonella typhi in water sources used for drinking and irrigation, posing a continuous threat to public health. For modes of transmission, this is one of the most important aspects because typhoid fever is primarily transmitted through ingestion of contaminated food or water. Poor sanitation practices and inadequate hygiene practices often facilitate its spread, particularly in densely populated areas. Overcrowded urban slums and rural communities with inadequate infrastructure are particularly vulnerable. Contaminated water sources also form the majority of this threat, as water makes up 70% of Earth's mass. Contaminated water sources serve as a significant vehicle for transmission of Salmonella typhi. Regions with inadequate water treatment and poor sanitation infrastructure are particularly susceptible to outbreaks of this disease. Let's move on to the symptoms. The common symptoms, as you can see in this black hand over here, this was created as a advertisement or something to gain more awareness of typhoid fever. Flies, carelessness, bad milk, bad water, and filth. These were the 5 most prevalent causes believed by people for the typhoid fever. Typical symptoms of typhoid fever include prolonged fever, weakness, abdominal pain, headache, diarrhea, or constipation, and these symptoms often develop gradually and can lead to severe illness if not addressed promptly. The severity of the symptoms can escalate very quickly from mild to severe within weeks. A high fever often exceeds 39 degrees Celsius, could be accompanied by chills, severe fatigue, and significant abdominal tenderness, indicating a serious medical condition requiring timely treatment. High fever, weakness, stomach pains, headache, and loss of appetite are another few of the symptoms. In severe cases, intestinal perforation, and even death. Complications if untreated. If left untreated, typhoid fever can lead to severe complications such as intestinal hemorrhage or perforation, intestinal bleeding, and encephalitis, which may result in sepsis. Mortality rates can rise significantly if appropriate medical interventions are not initiated. In endemic regions, typhoid fever contributes significantly to morbidity, particularly among children. Studies show that typhoid fever can cause prolonged fever, abdominal pain, and neurological symptoms. Finally, for intervention strategies to keep the majority of people protected from this very morbid disease. Vaccination options like TY28A oral vaccine and V polysaccharide vaccine are effective in providing immunity against typhoid fever. Vaccination is particularly crucial for travelers to endemic regions and populations in high-risk areas. Also, generally, if you are traveling, it is advised to take vaccinations according to the area and the prevalence of diseases in that area. The injectable vaccine is about 50 to 80% effective, while the oral vaccine provides approximately 50 to 67% protection. For some data and examples, typhoid and conjugate vaccines offer longer protection with fewer doses, proving highly effective in endemic regions with high populations. Mass vaccination campaigns in Nepal and Malawi have demonstrated significant reductions in typhoid fever incidence. Water quality control measures, controlling water quality, which is involving testing for pathogens and ensuring the treatment of drinking water, implementing water purifying techniques such as filtration, chlorination, and regular monitoring is essential to combat typhoid fever. Finally, hygiene and sanitation practices. Promoting hand hygiene, safe food preparation, and improving sanitation practices are vital in preventing the spread of typhoid fever. As you can see in this image, it is highly encouraged to wash hands often and properly, spending at least 1 minute to a minute and 30 seconds to ensure that all the bacteria are fully removed from whichever area you have previously been in, specifically if you have came back from work or school or about to have a meal. Educational campaigns can also target communities which can significantly reduce the infection rates. Additionally, boiling or filtering water before use and improving sanitation and sewage systems can prevent this spread. Access to clean water and proper sanitation can reduce typhoid cases by up to 70%. As I said earlier, Earth's water makes up 70% of the total Earth, and this clean water will be able to reduce the cases significantly as well. public health initiatives, and antibiotics. Government and non governmental organizations prioritize public health initiatives to combat typhoid fever. Efforts include community health programs, improved sanitation infrastructure, and vaccination campaigns targeting high risk populations. Before antibiotics, such as ciprofloxacin, azithromycin, were widely available, the case fatality rate for typhoid fever was 10 to 20%. With prompt treatment today, mortality is less than 1%. Thank you for learning about the typhoid fever today. This was Medicine Mindset. Thank you for watching. I'll see you in the next one.